Dr. Michelle Hardaway, who I have questions for after the show. But she's a plastic surgeon, and just go ahead and talk about why women come to you.
Okay, well, March is Women's Health Month, but it's also the month where women want to really get ready for spring and summer. So there are four things that I usually see women for a lot in March, and one is liposuction. Okay. And that's actually the most common procedure that plastic surgeons perform. Second is tummy tuck, or that's also known as an abdominoplasty. Also, I see a lot of women for breast reductions and breast augmentations. And breast augmentations are breast enlargements. Now, some of them.
You ever see any, like, for all three?
Actually, yeah. Well, yeah, I've seen. Well, not for enlargement and reductions, but for the.
I mean, for the reduction. Reduction. I mean.
Yeah, liposuction, tummy tucks, and reductions or enlargements.
But we'll talk after the show.
Okay. And one of the common things that, I should say, misconceptions that people have is that with liposuction, they can come in and get all the fat sucked away. Weight loss is still important. Liposuction is for body contouring. It's for removing fat in those hard-to-lose areas. So often, I'll tell a patient to try and lose weight. Maybe read Dr. Lucas's book. But that's one thing that is a real misconception. So liposuction is more for body contouring. Tummy tucks actually is a procedure that makes women feel very good about themselves. It's for women who usually have had children and their skin and abdominal wall muscles have been stretched. And despite losing the weight, they still have that bulge in their stomach. So what's done in this procedure, we actually tighten the muscles and cut off the excess skin. And if the patient is of normal weight, they can have an excellent result and they can have that flat stomach back. Breast reductions, a lot of women really didn't know there was something that could be done. They had large breasts, they complained of neck pain, back pain, shoulder pain, grooving on their shoulders from their bra straps. And they didn't know it was a procedure that could be performed. And a breast reduction is a pretty common procedure where you remove the excess breast tissue. And many women, as soon as they walk the next day, they realize that their symptoms are gone. Oh, and they didn't know that that was the cause of their back pain.
And right after your next panel that's coming up is going to Blue Cross Blue Shield, Omnicare. I want to know, is this paid for by insurance or not?
Of the procedures that I mentioned, that's the one that's paid for by insurance.
Oh.
Okay.
Okay.
I'll say most insurances.
Okay. Well, that's something definitely.
Right.
We'll just talk afterwards.
Okay.
Okay.